My name is Thad Westbrook. I'm chairman of the board of directors for Lexington Medical Center, and it's my privilege to welcome you here today. And on a personal level, it's my privilege to welcome Congressman Joe Wilson to Lexington Medical Center again. I've known Joe Wilson for many years. I grew up with Joe's sons over in Springdale. I've known Joe as a father, as a husband, as a state senator, and now as our congressman. And it's my pleasure to welcome him back to Lexington Medical Center and to hear more from Joe about the ongoing health care reform debate in Washington. This is an issue that's not new to Joe. As recently as this month, Joe has visited our hospital, to tour our facilities, to meet with doctors, to meet with nurses, to meet with our administrators, and to visit with our patients. I know Joe has taken this knowledge to Washington to represent us there. And so Joe, I want to thank you for your leadership in the healthcare reform debate, and thank you for coming back to Lexington Medical Center to speak to us. And if you would please help me welcome Congressman Joe Wilson.
And ladies and gentlemen, thank you for being here this afternoon. And this is a time, let's close the book on last week. Let's look ahead to work together for real health insurance reform. And as I'm here, it's really touching to be here with Thad Westbrook. Thad, as I have known him all his life, he was a page in our Senate office. He was extraordinary then. Now he's one of South Carolina's most prominent young attorneys. So I'm proud of his success. I'm here to also thank the people of South Carolina, and beginning with my wife, Roxanne. Her mother, Martha Dusenberry, is here. Roxanne is known as a star today of YouTube, so I'm very proud of her. And I'm very grateful that we have Roxanne. I give her the credit. We have 4 sons, 4 Eagle Scouts, 4 young men serving in the military of the United States. 2 of our sons served in Iraq, another served in Egypt. We're very, very grateful for our 4 sons and their success. Additionally, I want to thank my staff. This has been an extraordinary circumstance. Here in the Midlands of South Carolina, the Low Country of South Carolina, and Washington. And each one of them have stepped up to the plate with their competence, with their enthusiasm, and their loyalty. And so I appreciate my staff. Additionally, I want to thank the people of South Carolina. The people of South Carolina do know me, and I particularly would like to point out that I grew up in the holy city of Charleston, south of Broad. It is the center of civility in a civil state. And also, I am a graduate of Washington Lee University. That in Lexington, Virginia, is a college of gentlemen. And so I truly support civility. I have to give credit to my son, Alan. He said, "Dad, I know you. I know what happened. You were there on the House floor, and you had a town hall moment. And that was it." And I, of course, as a gentleman, immediately contacted the White House, apologized. It was accepted numerous times, which I appreciate. Additionally, the White House said, "Now let's begin a civil discussion of the issues before us." And that's indeed what I'd like to continue. I was very pleased that part of that discussion was citizenship verification. We now know last Friday that has been adopted by the U.S. Senate. It's been adopted in a release from the White House that citizenship verification will be included in the President's version. And so that should be an example of bipartisanship, that bringing an issue, clarifying an issue. But we've got other issues relative to health care that need to be addressed. I am so concerned for the senior citizens of the United States. When I hear that there will be a reduction in expenditures in Medicare and Medicaid of $500 billion, this is a threat to the senior citizens of America in terms of the care that they receive. When I hear that there will be taxes added on small businesses, I have always been a strong supporter of the National Federation of Independent Business. NFIB is the spokespeople for small businesses. they warned that the bills before us could cost 1.6 million jobs. I represent a community that has the highest unemployment ever here. We must be working to create jobs. Jobs are crucial for the lives and families of the people that I represent. And so the bill before us, I believe, can be changed. And that's why I'm very grateful working with Dr. Tom Price of Georgia. I have been very supportive of the Republican Study Committee Alternative Bill, H.R. 3400. At the town halls that I had around the district, we presented H.R. 3400. And I want to clarify something. There was an indication that a town hall in Richland County in Columbia, 1,700 people. It was the largest congressional town hall in the history of South Carolina. There was a report that it was raucous. It was not raucous. There were concerned people there. There were people there, true patriots. It was a great meeting. We're putting it up on the website. I want the American people to judge that meeting. These were really wonderful people. Now, there were some hecklers there. But I explained to them, I said after the town hall, I would be happy to meet with them. I would stay. I wasn't coming and leaving. And so they would have the opportunity to express their point of view. And then at Lexington High School, I was so grateful. We had 1,500 people. I've been having town halls in this particular community for 25 years in the state senate and in Congress. If I had 50 people come to the town hall, I was thrilled. But we had 1,500 people at Lexington County Hospital. Again, high school, not hospital. And thank you. See, my wife is really smart. So, but Roxanne, thank you. But 1,500 people were there. Again, people were very concerned. Over 95% were for health insurance reform. They were against a government takeover, a divide between doctor and patient, a threat truly to the health and safety of the people that I represent. We got to Beaufort, and it was startling. We moved from University of South Carolina at Beaufort to Beaufort High School for a larger location. The week before, the Friday before, I called the staff and they followed through. I said, hey, move every location to a larger location, the closest auditorium that is larger. We've got to accommodate. I want people to be able to come in. And so there we were at Beaufort High School, 1,500 people, hecklers, but still 7 of them. And so, hey, and I told them, hey, get with me later, and they did. Then Hilton Head Island High School, amazing. The largest facility that I was aware of on the island, 1,200 people. And then when the fire marshal said, Joe, enough, I said, wow, okay. But again, there were, again, it was a wonderful crowd of loving, dedicated patriots. These are Tea Party people, but they care about their country, and they're not against anyone. They are for America. They are for liberty and freedom. And so I'm very grateful. Let's discuss the issue. I particularly would love to discuss here at Lexington Medical Center H.R. 3400. But whatever the question is.